pathways to family medicine in the UAE beyond MRCGP International. In this video, we will explore the different recognized routes that doctors can take to work in family medicine in the UAE, from a licensing, classification, and career perspective. MRCGP International is often discussed as a major pathway to family medicine in the UAE. However, it is not the only route. There are multiple recognized pathways depending on a doctor's training background, postgraduate qualifications, and clinical experience. Many doctors look beyond MRCGP International due to the cost, time commitment, and multiple exam components involved. Additionally, the financial return in the short term may be gradual, which leads some doctors to consider alternative recognized specialist training pathways. A key concept in the UAE healthcare system is professional classification. Doctors are classified as general practitioners, specialists, or consultants. This classification affects salary, job eligibility, and long-term career growth more than the specific exam pathway alone. One major pathway is residency-based family medicine training. This involves structured multi-year specialist training programs with supervised clinical practice, rotations, and formal assessments. Such pathways represent full specialist training routes and are generally viewed as comprehensive preparation for specialist level roles. Another pathway is based on recognized postgraduate qualifications combined with relevant clinical experience after training. In this model, specialist eligibility is not determined by qualification alone, but by the combination of recognized training and documented professional experience. Family medicine training backgrounds can vary internationally. These may include residency-based specialist programs, board-certified postgraduate systems, recognized postgraduate training from South Asia, and other internationally recognized training pathways. Final recognition always depends on licensing authority evaluation. Post-qualification experience plays a major role in licensing decisions in the UAE. Authorities assess years of specialist practice, scope of clinical responsibilities, type of healthcare setting, and documented clinical experience when reviewing applications. Experience after training is often as important as the qualification itself. There are three main licensing authorities in the UAE: the Dubai Health Authority, or DHA, the Department of Health in Abu Dhabi, known as DOH, and the Ministry of Health, or MOH, which covers the Northern Emirates. Each authority evaluates applications individually, even though they follow unified professional standards. Specialist status in the UAE is determined through a combination of factors. These include recognized postgraduate qualifications, relevant clinical experience, training background, and overall professional profile. There is no single universal pathway that guarantees specialist classification. From a financial perspective, the pathway itself matters less than the final professional classification. Higher classification typically leads to a higher salary ceiling, stronger contract negotiation, and access to specialist level roles within the private and institutional healthcare sectors. MRCGP International fits into the pathway as an exam-focused postgraduate qualification with a structured academic assessment model. It can support career progression in primary care and family medicine, especially for doctors already working in general practice settings. A common misconception among doctors is that MRCGP International is the only route to specialist recognition or career progression in family medicine in the UAE. In reality, multiple recognized pathways exist depending on training background and professional experience. In conclusion, the most suitable pathway to family medicine in the UAE depends on training background, recognized postgraduate qualifications, clinical experience, and licensing authority assessment. There is no single best pathway for all doctors. The optimal route is the one that aligns with a doctor's qualifications, experience, and long-term career goals within the UAE healthcare system.